Hello and welcome to Newsreel. I'm Rachel Pather. Here are today's top stories. China gains international recognition for immediate responses to H7N9. Owning pets can help make you heart healthy. The 5th Breastfeeding and Infant Nutrition Conference supports working mums in the UAE. Chamomile tea can help fight cancer's superpower. The 5th Tango Festival wows Dubai. Cardio and weight training classes can reduce healthcare costs for seniors. Exergaming can improve children's physical fitness. And Beyoncé ignores doctor's orders to cancel her show. All this and more in today's edition of Newsreel. At a side event during the 66th World Health Assembly and World Health Organization, China gained international recognition for its immediate and effective responses to the H7N9 virus. The Chinese delegation convened the side event, which gathered officials and experts from international organizations and relevant countries to exchange information on the prevention of the epidemic. Chinese Health Minister Li Bin briefed the experts and officials on the cases of H7N9 human infections in China. According to her, the disease is both preventable and controllable and has seen neither qualitative change nor virus mutation. She added that no human-to-human transmission had been detected from the available evidence. The minister said that the Chinese government implemented the international health regulations, promptly notified the WHO and relevant countries about the epidemic, and shared the virus strains with the international community. Margaret Chan, Director General of WHO, said that the H7N9 influenza was an issue that deserved international attention and collaboration to find solutions. Chan said that the global public health and research communities have benefited greatly from China's sharing of genetic sequence data. Chan also commended China's prompt response to the disease and close cooperation with WHO. Research from the American Heart Association states that owning pets, especially dogs, is a good way to keep a healthy heart. The researchers pointed out that dog owners were likely to get the recommended amount of weekly exercise. Levine and his team reviewed several studies on the health of pet owners and found that they generally had lower levels of cholesterol, blood pressure and obesity, and often responded better to stress. One study of more than 5,200 adults found that dog owners were 54% more likely than non-dog owners to meet weekly recommended levels of exercise. Head researcher Glenn Levine said the data suggests there is an association between pet ownership and decreased cardiovascular risk. However, he added that people shouldn't adopt a pet solely to reduce the risk of heart disease. New research warns that the rising levels of obesity in middle age could cause a major increase in the number of dementia sufferers. According to the UK Health Forum, the risk of having dementia almost doubles with midlife obesity. It was found that by the year 2050, almost 7% of the population over 65 is predicted to suffer from dementia, costing 41 billion British pounds a year, compared with 23 billion at present. The researchers emphasised the importance of policies and interventions to prevent obesity and its related diseases in the population, including dementia. The study, presented at the European Congress on Obesity in Liverpool, also predicted that by 2050, nearly half of men and 31% of women will be obese. A new study from King's College in London suggests that the amount of time asthma patients spend soaking up the sun may have an impact on their illness. According to the study, low levels of vitamin D, which is made by the body in sunlight, was linked to a worsening of symptoms. The group investigated the impact of the vitamin on a chemical in the body, which is a vital part of the immune system for fighting off infections. In this study, vitamin D lowered levels of the chemical when it was added to patients' blood samples. Professor Catherine Horolorix, who was part of the research team, said people with high levels of vitamin D are better able to control their asthma. The team is now conducting clinical trials to see if giving the sunshine vitamin to patients could ease their symptoms. They are looking at patients who do not respond to steroids since they produce 7 times more of this chemical than other patients. Asthma patients find it hard to breathe when their airways become inflamed, swollen and narrowed. Most people are treated with steroids, but the drugs do not work for all. The 5th Breastfeeding and Infant Nutrition Conference was held in Dubai on May 25th. The conference, which was hosted by Philips Event, was conducted for mums, mums-to-be and healthcare professionals in the UAE. This year, the focus was on the role of mothers in the workplace and how working mothers can make the best choices to balance their careers along with the nutritional needs of their infants. Özlem Fidanci, Vice President and General Manager of Philips Consumer Lifestyle in the Middle East, said they recognise the challenges faced by working mums. He added that this year they focused on providing mums with the support and guidance they need to balance their commitments. During the event, mums and mums-to-be participated in breastfeeding and weaning educational classes conducted by experts in the fields of paediatrics, infantology and nutrition, helping mothers to overcome any challenges or fears they may have. A new fertility treatment is now available in Dubai. The treatment, called Alonva, was launched by MSD to target women in the Emirates facing infertility. Already a global issue, infertility affects an estimated 48.5 million couples around the world. In medical terms, a couple is considered to have fertility issues if they are unable to conceive after 1 year of unprotected, well-timed intercourse, or after 6 months if a woman is over 35. For many patients, the only hope of conceiving is through IVF therapy, an intensive and expensive therapy which requires daily injections. Alonva, which contains corofolatropan alpha, will offer a new option for women going through the process of IVF. It is considered to be one of the biggest breakthroughs in the treatment of infertility in the last 10 years. The new treatment allows patients to take a single injection of corofolatropan alpha over the course of a week, rather than the daily injection of gonadotropin, which is traditionally prescribed. According to Dr. Human M. Fatimi, Alonva can reduce the complexity and emotional burden that daily injections give. In nutrition news, did you know that your diet can help lessen your risk of skin cancer? May is Skin Cancer Awareness Month. Everyone is encouraged to be more conscious about their skin, and eating a healthy diet is one way to keep ourselves healthy and cancer-free. A number 1 tip is adapting the Mediterranean diet. The diet is high in nuts, fish, whole grains and olive oil. It offers over 50% increased protection in the risk of skin cancer. The protective omega fatty acids in these foods, along with fibre and vitamin E and D, give the body the nutrients needed to ward off cancer-causing cells. Another tip is drinking coffee and green tea. Caffeine is an ultraviolet sponge which is said to act like a sunscreen when applied topically to the skin. Coffee and green tea both contain polyphenols, which are antioxidants known to protect and even repair DNA from UV ray damage. Both coffee and green tea's polyphenols inhibit enzymes responsible for tumour growth. Another study has found that a chemical compound in parsley, celery and chamomile tea could halt the spread of cancer cells. Unlike normal cells, cancer cells have a superpower to escape death and can inhibit the processes that should cause them to die. Researchers from Ohio State University discovered that a compound known as apigenin, found in certain plant-based foods, can take away this superpower. Scientists suggest that epigenin essentially re-educates cancer cells into normal cells that will die as scheduled. Parsley, celery and chamomile tea are the most common sources of epigenin, but it is also found in many fruits and vegetables. Co-lead author Andrea Dosif said these findings can have great value clinically as a potential cancer prevention strategy. A European law due to be enforced in January of next year will ban bowls of olive oil from being served in restaurants prior to a meal. According to the new law, olive oil must be served in small bottles with tamper-proof nozzles and EU-approved labelling. This is to protect diners from possible contamination and improve hygiene. The new law is receiving a lot of bad responses. According to small olive oil producers, they will be affected the most as they do not have the capability to distribute in small bottles. This might prompt restaurants to just go for cheap mass-produced oil. Local authorities will be expected to carry out inspections to make sure the rule is adhered to. And coming up after the break, the 5th Tango Festival wows Dubai. Cardio and weight training classes can reduce healthcare costs for seniors. Exergaming can improve children's physical fitness. And Beyoncé ignores doctor's orders to cancel her show.